Welcome to SRNS Care Radio, where we explore the latest advancements in the realm of renal health. Steroid-Resistant Nephrotic Syndrome, SRNS, represents a complex and challenging subset of nephrotic syndrome, characterized by the failure to respond to standard steroid therapy, which is effective in the majority of nephrotic syndrome cases. This resistance complicates treatment and management, often leading to a more severe prognosis. The condition predominantly affects children but can also be observed in adults, carrying significant implications for kidney function and overall health. Nephrotic syndrome is primarily marked by four key symptoms: severe proteinuria, hypoalbuminemia, hyperlipidemia, and edema. The pathogenesis of SRNS involves a variety of genetic and molecular mechanisms. Genetic mutations affecting the podocytes, the cells responsible for blood filtration in the kidneys, play a crucial role. Mutations in genes like NPHS1, nephrin, NPHS2, podocin, and WT1, Wilms tumor 1, have been identified in many cases of familial and sporadic forms of SRNS. The pathology is not limited to genetic abnormalities. Immune system dysfunction and other molecular pathways involving cytokines and growth factors also contribute to the onset and progression of the disease. This complexity makes SRNS a particularly challenging condition to manage, as the multifactorial etiology requires a multi-pronged therapeutic approach. Diagnosis of SRNS involves a combination of clinical evaluation, laboratory testing, and often genetic screening. Initial tests typically include urine analysis to check for proteinuria, blood tests for serum albumin levels, and lipid profiles. Kidney biopsy is crucial for confirming the diagnosis, helping differentiate SRNS from other types of nephrotic syndrome, and providing insight into the severity of podocyte damage. Genetic testing is increasingly used to identify specific mutations associated with the disease, which can guide treatment decisions and provide information on the prognosis. However, the availability and cost of such testing can limit its use in routine clinical practice, particularly in lower resource settings. The treatment of SRNS is complicated due to its resistance to corticosteroids, the first line of therapy for typical nephrotic syndrome. Instead, treatment strategies for SRNS often involve calcineurin inhibitors like cyclosporin or tacrolimus, which can induce remission in some cases. Other immunosuppressive agents such as mycophenolate mofetil and rituximab have also been used. Supportive care is equally important and includes managing symptoms such as edema and hypertension. Angiotensin-converting enzyme (ACE) inhibitors or angiotensin receptor blockers (ARBs) are used to reduce proteinuria and control blood pressure. Dietary modifications and lipid-lowering medications may also be required to manage hyperlipidemia associated with the syndrome. Despite these measures, many patients with SRNS progress to end-stage renal disease, ESRD, necessitating dialysis or kidney transplantation. The choice of treatment often depends on the underlying cause of SRNS and the patient's overall health status. The prognosis of SRNS is variable and largely depends on the response to therapy and the progression to ESRD. Patients who do not achieve remission are at a higher risk of developing chronic kidney disease. The involvement of multidisciplinary care teams, including nephrologists, dietitians, and genetic counselors, is critical to improving outcomes. Steroid-resistant nephrotic syndrome remains one of the most challenging nephrological conditions due to its resistance to conventional steroid treatment and its significant risk of progressing to chronic kidney disease. Advances in genetic understanding and new therapeutic agents offer hope for more effective management. However, the development of personalized medicine approaches and further research into the underlying mechanisms of the disease are essential for improving the prognosis and quality of life for patients with SRNS. Thank you again for joining us here on SRNS Care Radio.